nerve supply of ear. Okay, you have pinna over there. Okay, and then you have a external auditory meatus, and then you have a tympanic membrane over here, right? Just a rough diagram, rough depiction for you. And in this tympanic membrane has a medial surface and also lateral surface, right? So, and here is external auditory meatus, and here is your pinna. Together forms the external ear, right? So we've come to a middle ear, we've come to a medial surface of tympanic membrane, and just imagine this is a wall, that 6-walled cavity of a middle ear, right? And here comes the inner ear. Okay, now it is just a very rough overview of a nerve supply, right? Here you have a medial and lateral surface, right? Laterally, most of the area, anteriorly, most of the area, medially and laterally, right? So laterally supplied by your greater auricular nerve. Okay, and for a lesser extent, here the medial surface supplied by auriculotemporal nerve, and together this concha supplied anteriorly and posteriorly to the ear is 7 and 10, and this 10 is Arnold's term. This is why you are getting cough while probing your ear or doing syringing. Okay, so this is about greater auricular nerve, auriculotemporal nerve, 7th and 10th nerve. Posterior to the ear, caudal or cranial surface, we mentioned, right? Cranial and caudal surface of ear. Just for a simpler understanding, I'm telling it as anterior and posterior. Posteriorly, the part is again supplied by 7 and 10 medially. Okay, and rest all the parts supplied by greater auricular nerve, and for some extent above it is supplied by lesser occipital nerve. Okay, so whole of the pinna supplied by greater auricular nerve, lesser occipital nerve, auriculotemporal nerve, and 7 and 10. Coming to the external auditory meatus, here again this 10 is pulled to here. Okay, 10th, and also this auriculotemporal nerve. The anatomy is always about understanding. More than understanding, it's about memorizing, right? So here you remember the 10 pulled here and auriculotemporal nerve also. The TM lateral and medial surface again this ATN auriculotemporal nerve, the 10th nerve, and the one that left behind, no, tympanic membrane wants to join with this two. So tympanic membrane lateral surface supplied by auriculotemporal, 7th nerve and 10th nerve. Finally, medial surface supplied by 9th nerve. You remember, right? Glossopharyngeal Jacobson's nerve. Okay, here it is in middle ear. Middle ear is again supplied by the 9th nerve. The